Hi there, or hold on. Hi there. I'm Dan Henderson. I'm a primary care doctor at Mass General at the Ambulatory Practice of the Future, and I'm here to talk to you today about colds and coughs and all the things that get us during the winter. And it just so happens that I have a cold today, kind of a nasty one. I want to tell you about what you can expect with colds, how to manage them, and when to seek help. So, colds are rarely serious. Sometimes they can be a problem for people who are older or people who have serious health conditions, especially lung conditions. But for most of us, colds are just a part of life. This is probably the first I've gotten this year, and it can be anywhere from none to 5 or 10. And because colds are almost always things that go away on their own, you really want to just treat the symptoms. So that's what today is going to be about. Now, everyone reacts differently to colds, and there are hundreds, maybe more, of different viruses that cause them. So it's hard to give specific instructions about what will help. Some of it is trial and error. But today we're going to talk a little bit about how to manage your symptoms and when to get help. So this cold started for me about 5 days ago. The first thing I noticed was kind of a dry, scratchy feeling in the top and back of my throat, and then I started to have a lot of nasal congestion. And then I kind of got a sore throat, and now I'm starting to have a lot of cough. I've got discomfort in my chest wall from all the coughing. All my muscles are sore from all the coughing. I have a tired wife who I've been keeping up all night. And so these are kind of the symptoms. And like I said, for everyone it's a little bit different, but you want to target your symptoms. So at the start of the cold, I did a couple of things. Because I had a lot of nasal congestion, I wanted to take care of that. So I picked up this product called the Neomed Sinus Rinse. I recommend this to a lot of my patients because it works really well. You flush that stuff out of your sinuses, and it helps keep things flowing, and it helps reduce the inflammation. And it doesn't feel great, but it works really well, and a lot of people really like it. The other thing I picked up, which I don't have with me today, is a nasal steroid nasal spray, like Flonase or fluticasone or Nasonex or Nasacort. Any of those will do. They're usually available over the counter, but you can also get them through a prescription from your primary care office. That helps to decrease all the inflammation and again kind of just keep things going, because the worst thing that can happen with the nose symptoms is that all of the excess mucus that the virus produces just gets stuck there, and that's how you get a sinus infection or how you just feel very unwell. Now the other thing I've been doing is trying to stay well hydrated to keep everything flowing, and I've been blowing my nose a lot. Sometimes when people want to avoid having to blow their nose, they'll take medications to dry up the secretions. Sudafed or pseudoephedrine or phenylephrine is one of the main ones. The only downside of that is that when the secretions get more dried up, for some people they can be more kind of stubborn and sticky, and some people prefer to just keep blowing their nose until it passes. So mine did pass, but then I started to have more kind of sore throat. So I picked up just some basic lozenges. These have honey, so I like them, but honestly I probably prefer the cheaper ones. I also was taking a regular over-the-counter anti-inflammatory pain medication like Tylenol or ibuprofen or naproxen, just to help with kind of the general aches and pains. So now we're getting into kind of the chest symptoms. My patients always say to me, it started up here and then it moved into my chest. And that is kind of what happens, because the viruses that infect the respiratory tract can infect all kinds of cells along the way. And so sometimes they start in one place, but they're causing inflammation all over, which eventually takes hold in other places. So now, like I mentioned, I'm having a lot of cough. Not too much right now, which is why I've got my mask off. And so I picked up a medication that includes the ingredient dextromethorphan. That's a cough suppressant, and it helps me not have to cough so much when I take a breath in and my airways get a little irritated and want to. Some people also will pick up medications that contain an ingredient called guaifenesin, which we know from the commercials for Mucinex. That can help some people, for others it may not. But dextromethorphan is definitely a good option to reduce the need to cough or the reactivity that you feel. You do want to be very careful. I have seen people overdose on this by taking too much, and that causes confusion and weird symptoms. So always take it as the box directs. And then for some people who have maybe mild asthma, inhalers or things like that can be helpful. And also just kind of taking it easy, making sure that you're staying well hydrated, getting enough rest, getting enough to eat. So that's what I'm doing for this right now. One of the things I tell people is that when you go to the cough and cold aisle, there are like 200 different medications there, and they're all different combinations. And I recommend knowing the ingredients that you want to get, in this case dextromethorphan, and focusing on that rather than getting combinations. It does get more expensive, especially if you don't pay attention to the cost per pill, but when you take a combination medication, you're at risk for getting something that you don't want, or for double dosing on something, especially things like acetaminophen or Tylenol, which at very high levels can be dangerous, but is totally safe at regular doses.